Welcome to the deep dive. We're here to cut through the noise and get right to the heart of some really crucial information. And today, honestly, we're diving into something that might genuinely shock you. It could change how you look at certain things, maybe things right in your own medicine cabinet. We're talking about over-the-counter arthritis supplements. Sounds harmless, right? But some might be secretly hiding powerful, unlisted pharmaceutical ingredients, and they're leading to some incredibly serious health problems. Our source for this deep dive today is a really important recent brief report. It's titled Impact of Surreptitious Glucocorticoids in Over-the-Counter Arthritis Supplements. So, our mission really is simple. Unpack what this study found, understand the very real health impacts, and basically arm you, the listener, with vital info.
Yeah, and this isn't just like a one-off thing. These OTC health supplements are everywhere. People use them all the time. But there's this hidden problem, right?
Yeah.
They can contain potent drugs that aren't on the label at all. We're talking things like powerful steroids, glucocorticoids, sometimes NSAIDs, prescription strength pain relievers, even muscle relaxants,
Yeah.
all hidden.
Okay, let's unpack this then. The core issue is these supplements, often marketed as natural relief, might actually contain potent hidden drugs. So which products are we talking about specifically in this study? The report zeroes in on 3 supplements found to contain these undisclosed steroids: Archer King, Artisans, and Edjo Ray. These are commonly used for joint pain. And it's worth remembering, the FDA actually warned about Archer King back in 2022. They found it contained dexamethasone, a strong steroid, completely unlisted.
Right. And, it's interesting with artisans that one apparently does list a steroid, betamethasone. But the study really emphasizes the danger of this kind of exposure overall, whether it's totally hidden or maybe listed but still problematic in an OTC context. The risk from these steroids is significant and unregulated.
And the health consequences they found, they're really severe. We're talking about things like Cushing syndrome, CS, and adrenal insufficiency, AI. Cushing syndrome basically is what happens when your body gets way too much glucocorticoid, like from taking these hitter steroids for a long time. Adrenal insufficiency is kind of the opposite problem. It's when your body stops making enough of its own natural cortisol. Often happens when you suddenly stop taking an external steroid that your body got used to. It's a major shock to the system.
Yeah, it really is. But I think where this really hits home, for me anyway, is looking at the actual patient stories. This study gives us a case series, 12 real people. So what can these cases tell us? What were people actually experiencing? Well, this case series looked at 12 patients. They were all seen at one Urban Safety Net medical center between 2022 and 2023. And in terms of what they were taking, 8 used Archer King, 3 were on Artisans, and 1 person took Osho Ray.
Okay. And the people themselves?
The average age was around 51.6 years. A third were female. And interestingly, all 12 patients identified as Hispanic or Latinx.
And the thing that really jumped out at me was how long some of them were taking these supplements. The median was 6 months, which is already quite a while, right?
So-
But the range, some people took them for just 3 months, others for up to 120 months.
A decade.
A full decade. Taking hidden steroids without knowing it, that's staggering.
It really is. And, what's striking is how they presented clinically. The symptoms were pretty stark. 10 out of the 12 patients, that's 83%, a huge majority showed clear signs of Cushing syndrome. We're talking classic signs like moon facies, that rounded face, in 2/3 of them. Central adiposity weight gain around the middle, again, 2/3. Abdominal striae, stretch marks, in half. And then things like a dorsocervical fat pad, that buffalo hump, and easy breathing, each showed up at about 1/3 of the patients. These are not subtle changes.
No, definitely not. And then there's the flip side, the adrenal insufficiency. That showed up in 8 out of 12, so about 2/3 again. What did those symptoms look like?
Common AI symptoms were things like nausea and vomiting. That affected about 42%. Fatigue, also 42%. And abdominal pain in about 1/3 of them.
And just to underline how serious this all is, 8 of these 12 people, 2/3, actually needed to be hospitalized, and 3 of them, a quarter of the group, ended up in the ICU, the intensive care unit.
Yeah.
So yeah, these are definitely not minor side effects we're talking about. This is serious, potentially life-threatening stuff.
Absolutely. So figuring this out, the diagnostic process involved a few things. They did initial cortisol level checks. 4 patients clearly had AI based on low cortisol. 5 had levels that were sort of ambiguous, equivocal, and 2 were normal initially.
So not always straightforward at first glance.
Not always. That's why they often use what's called a cosyntropin stimulation test. It's a way to really check how well the adrenal glands can respond, and that test confirmed AI in more patients, especially those whose initial levels were kind of borderline.
Okay, so once they diagnose it, what's the path forward? How do you treat this?
Well, treatment usually involves replacing the cortisol the body isn't making.
Right.
So 10 out of the 12 patients were put on glucocorticoid replacement therapy, usually hydrocortisone, sometimes prednisone.
But getting off that replacement therapy, that sounds like the really hard part.
Absolutely. The recovery was often incredibly challenging and really prolonged. Only 3 patients, just 3 out of the 10 treated, were successfully weaned off the replacement steroids during the study period.
And how long did that take them?
Well, one patient managed it in 8 days, which seems fast, but another took 365 days, a full year,
A year.
and the third, an astonishing 1,134 days.
Wow, over 3 years.
Over 3 years. And then 4 other patients were still on treatment after nearly a year or more, like 284 days. The other 35, 378, 464 days, still needing it.
And 3 were lost to follow-up, so we don't even know what happened.
Exactly. So it really highlights how difficult recovery can be.
So why? Why is it so hard and takes so long?
It comes down to how these external steroids affect your body's own system. That prolonged exposure, it basically shuts down your natural stress response system, the HPA axis, hypothalamic pituitary adrenal axis. It's like your body's internal cortisol thermostat gets turned way down or even off. And getting it to turn back on and function properly again, that can take a very, very long time.
Like over a year is common.
Easily. Sometimes much longer, as we saw here. Some patients in this group needed support for, up to 37 months just to get their system potentially back online.
And while they're trying to wean off, they're still feeling sick?
Often, yeah. They might continue to have AI symptoms, or their cortisol levels just stay stubbornly low, making it really tough to reduce the replacement dose without causing problems.
Okay, so how does this study compare to what we knew before? You mentioned other reports.
Yeah, the researchers looked at the existing literature, about 7 articles covering 10 previous patient cases. Those earlier reports also showed high rates of Cushing syndrome, maybe even higher, around 90%. But interestingly, they reported fewer AI symptoms, only about 20%, and those patients consistently had very low morning cortisol levels.
So this new study shows maybe more AI symptoms and a wider range of cortisol levels.
Exactly. It suggests maybe a more varied picture. And the reasons for the differences could be lots of things. Maybe differences in how long people use the supplements or how much they took. Maybe the timing, like did they stop before they got tested? Or perhaps the earlier, smaller reports had some selection bias, maybe only catching the absolute clearest cases.
Right.
So what's fascinating here is how this larger case series helps refine our understanding. It suggests the presentation can be quite varied.
So wrapping this up, what's the big message here for people listening? What do you need to know?
Well, for healthcare professionals, it's a huge flag. They really need to be vigilant, asking patients about any OTC arthritis supplements or really any anti-inflammatory supplements they might be taking, especially if someone comes in with weird symptoms. Maybe signs of adrenal insufficiency like fatigue and nausea, but also some signs of Cushing syndrome like weight gain or easy bruising.
Ugh.
That combination should ring alarm bells.
And you mentioned testing.
Yeah, if a patient isn't sure what they took or doesn't remember, there are objective tests. Urine or blood tests can screen for synthetic glucocorticoids. That could really help pinpoint ongoing exposure.
Okay, and this is maybe the most critical warning. If you are taking one of these supplements, or suspect you might be,
do not just stop taking it cold turkey.
Right. Don't just throw it away.
No. Immediate discontinuation is incredibly dangerous. It has to be done under medical supervision. They need to consider giving you cortisol replacement because stopping suddenly could trigger an adrenal crisis.
Which is a life-threatening emergency.
Absolutely. So it's definitely not as simple as just stopping. It needs a doctor's guidance.
Well,
And ultimately, this whole situation, finding hidden prescription steroids in OTC products, it raises massive red flags about regulation and consumer safety. We really need more public awareness, more discussion about this, which is why, talking about it like this is so important.
absolutely. This deep dive, it's really laid bare a shocking reality, hasn't it? These common supplements, things marketed as natural, can hide these incredibly potent drugs. And what's really striking, I think, isn't just that they add a drug you didn't know about. It's how they fundamentally mess with your body's own crucial systems. They break that internal thermostat, like you said, and the road back. It's not weeks, it can be years if you get back at all. It's truly insidious.
It is.
So here's something to really chew on. We see these OTC products everywhere. They seem so harmless, so available. What does this whole situation tell us about that wider landscape of consumer health products? And maybe more importantly, how can we, as just individuals trying to stay healthy, demand better transparency? How do we get better at questioning what we put into our bodies, especially when something sounds maybe a little too good to be true? Something to think about.